Good afternoon and welcome to the Weekend Wellness Hour. Today we have Dr. Dan Wool, who is joining us to talk about that fight or flight nervous system, the nerve that helps regulate that, and our gut. So Dr. Dan Wool is a naturopathic physician who specializes in gastroenterology. So I'm very excited to have him on here because so many people, almost everyone I know, has some type of gut issue and is always looking for solutions on how to fix that. So thank you so much, Dan, for being here with us today.
My pleasure, Amy. It's great to be here.
Good, wonderful. So I'm really curious how you got started into this naturopathic world because your story is very interesting. And I think a lot of our listeners could actually relate to it.
Yeah, it's a little bit of an unusual way around. I became a naturopathic doctor making a mid-career change. And basically, I was a stressed out corporate manager. I did public relations for 20 years, being spokesman for big companies or creating strategies for smaller ones. And it always meant that I was kind of the guy out in the front taking the slings and arrows. And it's an incredibly stressful job. It can be a very rewarding job too, but after 20 years, it was something I was always good at, but not necessarily liking. And it really started to show up in my gut. I was really stressed out. And, we always hear trust your gut, trust your gut. And mine started burning like crazy. And I went to the doctor. They put me on a Prilosec, and it was fine for a little bit. And then they put me on more, and it was fine for a little bit, and then more and more. And eventually, I just couldn't get that under control over 3 years, and nobody could really tell me what was going on. Some doctors would, prescribe me more drugs, and I'm like, this just doesn't seem right. And eventually landed in a naturopathic doctor's office, and she said, I think you might have celiac disease. Sent me for a scope, and sure enough, that's what it was. And then some herbs, a diet plan, and 3 months later I was as good as new. And I was just like dumbfounded, like how could it be that easy when somebody gets to the root cause? And then to be good as new right after that, and off the medications and everything. And I was in the midst of looking for a new career, and I started asking the naturopaths how they got into theirs, and many had similar stories to me. And so decided to make the leap and go to medical school for 4 years. And, here I am now, a licensed doctor in practice, treating folks like the old me. I really have an affinity for gut health. So it's really been great. I love my job every single day, trying to help the folks who once were like me, real stress cases. And it tends to show up first in the gut. I've seen that play itself out in practice many times. So like I said, it's been a pleasure to help those folks.
That's wonderful. And we know stressors are huge in our lives right now. I mean, our world, we live in a fight or flight state, and we're constantly have a barrage of information or worries or fears. And yes, like one of the first responses, you feel that tightness in your gut, or you feel something off, you don't feel well nourished, anything like that. So I'd like to dive into a little bit about that fight or flight nervous system and what is the vagus nerve and how does that relate?
Right. So, we have an autonomic nervous system that just it works kind of automatically. We don't have to eat food and then stop and think like, or like we don't have to think about our heart beating and like, oh, beat, beat, beat. No, we don't have to do any of that. The brain just takes care of all this stuff automatically. So we have a sympathetic nervous system, which is your fight or flight. That's what we hear so much about. And then we have this parasympathetic nervous system, which is more called a rest and digest. And original factory setting of our bodies is really the parasympathetic nervous system. We used to be creatures, communal creatures, and all working together and very working in peace. And then a lion would creep up on the village, and all of a sudden everybody tensed up, and that was a very rare occurrence. And now every day, like you were saying, stress is all around us, and we all still have that, oh my gosh, there's a lion, sort of response to it. And that could be an email from the boss. It could be, being 5 minutes late to pick your kid up from school, whatever it happens to be. But we have that exact same response. And what happens is it ends up turning into this chronic stress because we're technically not really designed that way. And so when we're in this constant sympathetic state, it starts to affect things. Like you said, we get tight in the gut. But let's talk real quick about what the sympathetic nervous system is meant to do. It's meant to, take glucose from anywhere in the body, throw it into the muscles so that it has the fuel to run away. The other thing is if you're injured, the main thing that the sympathetic nervous system does is it draws the body's attention to the injury. Number one, like if you broke your arm, you're going to get a little bump there, but it's going to send a signal to pain like, don't use that arm right now, it's hurt. And the other thing it's going to do is inflame that area to send this massive healing response to there. And it might take a couple months to heal a broken arm, but the process is more or less the same for anything in the body, whether it's a cut, a broken arm, or in what we're talking about, the gut. And a lot of times where I see things start to go awry, we eat in the sympathetic state, or we're eating something that's irritating the gut, and we're in the sympathetic state. Well, if your gut's irritated, what happens? You're going to create more of a sympathetic state. The body's going to, inflame it, say, don't eat, but we can't not eat. And then it's going to, send a response in to heal it. And it wants the room to heal it. It wants the time to heal that. And so, again, moving back to the other nervous system, a rest and digest nervous system, that's why we need to be as parasympathetic as possible, as rest and digest. We need to be resting and digesting. And that goes all the way down the line. And so what do I mean by this? Sympathetic stress can happen. I have a lot of patients who come in and they watch TV when they eat, or they're looking at their phones while they eat, or they're eaters of convenience. Like most of us, we're losing the ability to cook, or at least the time to cook. So we rush out the door and we're eating, standing up, or we're eating something in the car when, traffic's rushing at us. That's not parasympathetic. That's, you're in sympathetic state. So when you're running from a lion, the last thing you're doing is eating. The last thing you're doing is pooping, having sex, all these other things that are parasympathetic. The body just turns it off and says, run, run, run. Yeah. We don't want that when we're eating. And when we don't do that or give it what it needs, we end up with that tight gut and we start to have a lot of downstream problems. So that's a lot of what I see. And, the number one thing, Amy, I say that I see in the clinic is stress. It doesn't matter what the diagnosis is, it can be caused or exacerbated by stress. And I don't mean to paint it with too broad a brush here, but, when it comes to gut health, it becomes a real root cause of that. And that's what we're always striving to get to as naturopathic doctors is, find that root cause, and then you pull that string, and all the other, gut symptoms tend to come along with it. So that's the general overview. Just you asked about the vagus nerve. The vagus nerve is the parasympathetic nerve. That's the nerve that is designed to calm us down. Now we have 12 cranial nerves doing really important things, helping us see, helping us move. These come right out of the brain and go right down to where they're needed. So in case of seeing, they're right behind the eyes. There's a few of them there. And then one is the vagus nerve. It goes all the way from the brain down our gut, just above and touching all the organs, including the heart, the stomach, right up above the diaphragm, which is a different nerve to help us breathe, called the phrenic nerve. But so it's really important for that nerve to calm that process down. But if it doesn't really get the room to do that, what happens is we end up in a sympathetic state. It's kind of like taking the brake off when you're going downhill. It's like the brake's not working, and so you just keep picking up momentum, and that's not what we want to do. With the body, we want at least to have that give and take. If you're starting to move downhill, you hit the brake, you put a stop to it, and and start to to go the other way. And so that's why the vagus nerve is so important, and why that rest and digest is so important, as we eat and as we digest. So
the vagus nerve actually goes into the digestive organs as well, right? Like Correct. It touches some of them as well.
Absolutely. And so, it can also help to move our food along. That's a primary function, but the opposite is, the sympathetic nervous system, and those nerves, will put the brakes on it for the reasons that we talked about. It's like, hey, we don't need to do this right now. We need to run. I'll just keep using that metaphor over and over again, but that's literally what's happening, despite how minor you and I or anybody who's watching this might think that stressor is, just in our day-to-day lives. It's things that we think that we can manage. It's things that we don't think are stressing us out just because we're used to it. But we definitely don't want to be in a chronically stressed state because, again, downstream problems start to happen. Like I said, I tend to see this show up first in the gut. And then what happens when it becomes chronic, all of a sudden becomes things like autoimmune disease or hormone depletion. And, there's a lot more work to do to try to reverse that. So I preach a lot of self-care. I preach a lot of, what we call hygiene, eating hygiene, sleep hygiene, things like that, that automatically calm us down and get us to that original factory function to be parasympathetic beings and function normally. And I know you see this in your work quite a bit when you can do that and calm things down, that all of a sudden, a lot of other things start to, a lot of other problems start to fall away as well.
Yeah, absolutely. Pain, restrictions, all of that. So
Yeah.
it's really important when we look at the gut. So let's say we're eating.
Yeah.
We're eating a meal and maybe we're watching TV and it's blaring something that's very emotionally charging for us. So what is actually happening at the gut level in terms of, okay, we get into this fight or flight state. We can't access the vagus nerve to calm us down.
Yeah.
What's happening at the gut? Is it things aren't getting digested? Are we not getting absorption? What are things that's truly going on down there?
Yeah, I mean, there's a few things. Digestion, absorption is one of them. Again, think about it. In comes the stressor, sympathetic nervous system on, parasympathetic nervous system off, and instead of digesting food, the functions are shunted to other things because they're deemed by the brain as being more important. So instead of this nice smooth wave of a peristalsis of which is the food and going very incrementally and slowly through the body and nutrients being absorbed, that stops essentially because it's not a priority at that moment. It might be later when we need it for fuel, but right that moment it's not. So people will start to get the symptoms that start to crop up are things like acid reflux. That the stomach's getting irritated, it's hitting that vagus nerve, and then it kind of goes up into the back of the throat. You might hear people have like a hoarse voice. They may eat and then or have a cup of water, and then all of a sudden their voice is hoarse, which is unusual, right? Because you see people like public speaking, for instance, and there's always a glass of water sitting there, and then if they're stressed out, they're going to have that, and it might it tighten up the throat because again that nerve is running from the middle of the belly up into the brain, touching all the different organs. So that digestion is not happening quickly. I see it show up. You get indigestion, it shows up as pain, it shows up as acid reflux, really severely it can show up as gastroparesis where you get nerve damage and nothing moves in the gut. It's like paralyzed. But most commonly it shows up in the upper gut in those ways, and in the lower gut it shows up as constipation. I see a lot of constipation, a lot of anxious or stressed out people, and they eat just fine, they have the proper diet, but once it gets down to eliminating, they're just not able to move anything because again they're in that stressed out condition. It's not a priority at that moment for the body. The body just wants to run, even though that these things are more or less virtual at this point. It's very primal to the brain. So that's how I usually see it show up.
Yeah, and that's interesting, especially with the constipation issues. I often work with people on how their body position, the rib cage position, affects whether they're in fight or flight mode or not. And so many people try to lift up their chest and suck up their gut, which puts them in a fight or flight state, but it also decreases space for their digestive tract and their elimination process. And so I see people who do have constipation issues, they start to let their belly out a little bit so they're not so pulled up and in, and they seem to be able to move food and move waste products.
Absolutely. And that's the nerves that we're talking about too. Once those nerves can relax and kind of switch gears almost, then all of a sudden everything kind of functions as normal. I mean, again, just going back to that example of the people around the campfire on a savanna, it's like, it's almost like meerkats where they hear something, they kind of poke their head up, and then they return back to normal, and the body is designed that way, and it does return everything back to normal. And so if you can't get it realigned or breathing properly or even seating properly, I mean we have people who are sitting at desks all day, that we're not moving around. Moving is something that we're also designed to do, obviously, but it also relieves stress.
Yeah.
So you're sitting at a desk all day in one position, the shoulders way too forward or the shoulders too far back,
Mhm.
that's definitely going to affect the way that the nervous system reacts. And these are very, very subtle things, as you know,
Yeah.
but when it comes to digestion, it starts to build up over time. You can imagine if somebody's constipated, for example, the type of waste, as opposed to the body just, exchanging fluids and nutrients on the fly down there. I know it's poop, but that happens. Everything comes to a halt. Things start to, putrefy, proteins start to putrefy around the sides of the large intestine. And all of a
Okay.
sudden, what is the body exchanging? It's not exchanging, the fluids and nutrients it needs. It's exchanging, these toxins and things that start to, build up. So that's obviously why we have to eliminate, on a day-to-day basis. But, that's one of the downstream effects of being in a sympathetic state too long, being too stressed too long. And, there's very easy ways, to just to flip that switch. And it really is that easy to flip that switch to, get everything, back to normal.
Yeah, and when it comes to flip the switch and trying to access the vagus nerve to get rid of that dysfunction, are there certain things you look at? So I know some common things are working on your breathing, exercising, but is there specific foods that you talk to people about or something about the way you eat,
Mhm.
chewing, or anything like that that you recommend?
Yeah, there's a few things. You mentioned chewing, so let's start there at the top
Yeah.
of the mouth and work our way down. But
Okay.
we're it sounds so obvious when we say these things, but we're meant to chew our food, and it's what our
Yeah.
grandmothers say, like stop eating so fast. They say that at dinner table or slap your hand or something. At
Yeah.
least that's the way it was with my grandmother. But we're meant to chew the food. We actually have digestive enzymes in our mouth, amylase and lipase. So when those carbohydrates and fats, the prioritized fuels in our body come into the mouth, we want to break them down as much as possible and as quickly as possible. So that's why those things are in the mouth, so that they're all pre-digested and ready to go when those same enzymes hit it in the gut, and then it hits the small intestine, everything's absorbed, and we have enough energy to do what we need. But how many of us go out to, let's say, like fast food? I have a Chipotle across the street here. I could take one of those bowls down in about 5 minutes, and that is not chewing your food. That is wolfing a bunch of things
Mhm.
down. We have a bunch of undigested things. That means that as we get lower down into the stomach, where we have pancreatic enzymes to soothe things, where we have bile coming from the gallbladder, where we have stomach acid and histamines kind of coming up from the stomach to try to emulsify and break all those nutrients down. Those things have to work a lot harder. More has to be secreted. It really tires those organs out. And if we're in sympathetic mode to begin with, the last thing that the body is wanting to do is secrete those organs to begin, secrete those pumps and everything to begin with. It's like, whoa, stop eating. We're doing something else right now, and we're going to take care of this stuff later. And essentially, we start to get indigestion. Things pass from the stomach to the small intestine, somewhat undigested, and then the nutrients, which are supposed to be in this like really easy form to digest, it's not, and it's not passing through cleanly. It's causing gas. All these things that are meant to break it down cleanly and not give us any trouble are now starting to hurt. They're attracting the wrong kinds of bacteria to break them down. And so there's any number of things that happen. So yes, it starts in the mouth. We need to have be in a parasympathetic state, let it flow cleanly down into and smoothly down into the gut, and then the gut needs to be in a relaxed state so it can break everything down and into the proper fuels. So some of the things I see, that's when acid reflux happens. We eat too much too fast. It stretches the stomach, and we get the signal to, hey, stop. It's too much. We get the
Yeah.
indigestion, and hey, once in a while we go out to a big meal. There's a big portion or something, and that'll happen once in a while. But when there's folks out there doing it every single day, all of a sudden, we're in a chronic state, and that starts to court disease.
Yeah.
So the signaling from all these things, the neurotransmitters, to tell the body to to do this delicate dance of digestion, they start to go a little awry. And And that's not what we want. You also mentioned food sensitivities. When the gut is inflamed, that's when the food sensitivities are either causative or they can exacerbate it. So what do I mean by food sensitivities? These are things that we eat that are irritating the gut. Genetically, some things we just may be allergic to. I have something called celiac disease. If I eat wheat, I get very sick. That's something that's genetic. But most people are eat just fine, but when you're not eating in that parasympathetic state, and that inflammation happens, again, the sympathetic gut's going to pull resources to try to heal it. It's kind of like, for instance, if you were sensitive to milk and you were having milk every single day and it was causing this irritation and gas and bloating and pain, and you're doing it every single day, at a certain point, it's like a punch in the gut. And if somebody came to your door and punched you in the gut every day, like by day 2 or 3, you'd stop, right? So, once you stop and give the body the room to heal that, it's fine. But we have to remove that stressor out of the diet. So we can do things like food sensitivity testing to try to understand what those are. We can do things like elimination diets just on a temporary basis. I like people to eat as wide a variety of foods as possible, but if there's a food or two or several that are healing, that are hurting you, then we want to heal that up. Just the same way you're going to put a Band-Aid on a wound. You want to take away the things that are causing the wound for a short time and then add them back in.
Yeah.
And then the other thing is those food sensitivity tests, when I see them like light up with everything, that's when I know somebody has a leaky gut, or somebody may have what they think is seasonal allergies, but really it's the whole pharynx and and gut complex are really just irritated. And so when that food comes in, it's triggering more of an allergic sensation. And and so once we heal the gut, people find that their allergies and go away, along with a lot of the other gut related symptoms that we're all used to.
And I can imagine that's important in terms of if someone is eating quickly and not chewing, and they're kind of in that fight or flight state, and they eat, and if they don't feel satiated, like they're not getting nutrients, then they're tired quickly, afterwards, or they get hungry again. A few hours later, they eat some more, but it's not because they're digesting, but it's almost like they're just continuing overloading their system, and they're not going to get the nutrients in. Is that right?
Yeah, and that's exactly right. And the stomach has stretch receptors in them. So it's designed to stretch. We're designed to eat, I don't know, several handfuls of food, but you have a sorry, Cheesecake Factory, but you have a big meal and then put a cheesecake on top of that. That's going to fill the stomach pretty much. And those stretch receptors, tell the brain, hey, we need some time down here. We have too much. Now the stomach will stretch and it'll go back into, the way it's supposed to be. But, it may also, that's why you may fall asleep. The other thing is it sends too much of an insulin response. So we're not designed to have too much sugar running around. Most of that's shunted into the muscles for use. But if there's too much sugar, then the body sends too much insulin. So you get this spike of sugar and then this spike of insulin that goes all the way down, and it makes us sleepy. Instead you want to keep the insulin kind of in this narrow range, and it can kind of bounce around, but it's never going to go too high or too low. But when it does go too high, it will go too low. And then that's where you get that sleepiness coming in. And a lot of my patients, they tend to get in these cycles where they'll eat a big lunch, they'll go back to work, and then all of a sudden everybody is really tired and hungry around 4 o'clock in the afternoon, 4 o'clock in the afternoon. They just hit the wall. And that's part of the reason. It's, we're just out of that rhythm of eating properly and being in a narrow range of blood sugar. Our cortisol gets out of whack. Cortisol is our stress hormone that tells the body to dump glycogen and storage forms of sugars. And so, because it's an emergency of the brain that it doesn't have any. And so they start to, they dip around 3 p.m. And I also have the patients who wake up at 3 a.m., same thing, another cortisol response, a little bit different, another topic for another day, but definitely, eating within, eating a certain amount and keeping that glucose in check, and eating the right fuels, tend to keep us in that parasympathetic state.
And I'm curious, because I've had many conversations on nutrition in general, and do you see certain foods creating an inflammatory response that's kind of goes along with that sympathetic nervous system flight response?
Yeah.
Are there certain foods that when someone's in a heightened state, you say, okay, you know what, let's cut back on this to really one, get you into parasympathetic, two, to help your gut,
Hmm.
and three, maybe even stay off for good or introduce, a month from now?
Yeah, and that's a great question. The food sensitivity tests, usually reveal those. And then, yeah, we do the elimination diet for, about 6 weeks. And then, we put everything back in. Like I said, I want everybody to eat as much and as wide a variety of food as possible. But there are times where that food can be hurting you. Now, is it just a sensitivity or is it like a true, food allergy? And there's ways
Yeah.
that we can test that. For instance, I mentioned celiac disease earlier. If somebody is eating wheat, we can test them and just see, is that part of celiac disease or some sort of, gluten sensitivity. A lot of people are lactose intolerant. And so there are tests out there where we can actually test to see if the lectins, which are the proteins in, certain plants and grains and, milk and other things, are these proteins, inflaming the gut? And then those become really good culprits. I usually have my patients do what's called a diet diary, where they just track all their food and their symptoms for about a week. And then we match those two things up and say, well, is this something that's a true allergy or just a sensitivity for now because, we have this chronic gut inflammation? The remedy is always the same. We can kind of dial back, those foods. We don't want it to punch us in the gut and inflame us.
Yeah.
And then we can add them back in. And then usually when we add things back in, if they're still really spinning off symptoms, this can be things like, skin symptoms like hives, or these can be, gut issues, gas, bloating. If there are other things like, uh, hoarse voice, things like that, and all those symptoms come back, well, something's probably a true sensitivity. After you've healed the gut up, you add those things back in and they're still causing the symptoms, then that's probably something that somebody should leave out of their diet, for a very long time, if not forever, just depending.
So basically, you're saying that you don't recommend a certain type of food across the board. Like, you don't tell people caffeine no or dairy no. You
Mhm.
do you look at you only do sensitivity tests individually, or is there something like across the board that you say, no?
Yeah, dairy, about 75% of people have lactose intolerance, or the inability to kind of break down lactose, which is the sugar in milk, for instance. So,
Mhm.
I mean, there are common culprits,
Yeah.
wheat, dairy, soy. These are all very common, too much sugar. These are all very common culprits. But I'm not somebody who wants to restrict anybody because, unnecessarily. The other thing is, if I get a lot of people who come to me from gastroenterologists who have been scoped and they have been diagnosed, which is good, but we can try to figure out, well, what caused the gastritis or the ulcer, and work on some things to heal them, to heal them back up. And that's when we will do the testing. But those gastroenterologists, they know that certain foods exacerbate an ulcer or gastritis, which is irritation of the gut. And they'll have a list of things like, chocolate and mint and tomatoes and things like that. And it's a pretty standard protocol to help heal an ulcer, for instance. But I always like to, make sure that we get to a very specific diagnosis before restricting anybody's food.
Yeah.
There's another class of foods, Amy, called FODMAPs. These are
Mhm.
called fructo-oligosaccharides, and this is why they call them FODMAPs.
A little
Long
easier.
name, but these are a specific kind of sugar that paired with an oil in certain kinds of foods, it can really irritate the gut. I see this a lot, intolerance to this a lot in IBS, for instance, irritable bowel syndrome, that usually has diarrhea associated with it. Anything that's foul to talk about, I treat. So diarrhea, constipation, all these things. But so that might call for a low FODMAP diet, where we keep these things out of the diet for a limited amount of time, so that we can see if that is something that's causing it, have an opportunity to heal that gut back up, and then we can add them back in a little by little. The body's pretty amazing. The gut tends to heal itself, but again, we got to give it the room to do it, and we got to get to the root of what's going on before we start making broad-based restrictions. But yeah, those tend to be the culprits. Dairy, wheat, oats, and not oats, but dairy, wheat, and soy, and then so if people want to test it, they can, but I'd preach to, just do it for a limited amount of time. Or if you see an improvement, it's like, oh, okay, maybe that
Yeah.
thing's a true sensitivity. But what ends up happening in some people, they get anxious and then they reduce this and reduce that, reduce this and reduce that. And all of a sudden they're not eating much of anything. And then
Yeah.
we're getting, flora imbalances and other conditions downstream, from these good intentions. So we always
Yeah.
want to try to diagnose and get a game plan going, with the doctor if possible.
That makes sense. And now you kind of mentioned IBS a little bit, irritable bowel syndrome.
Yeah.
Now, how does the vagus nerve come into play to some of these common gut disorders?
Yeah, that can be an overstimulation of the vagus nerve. So you can go too much digest, so to
Okay.
speak, and it ends up speeding things up. The most common, when we think of diarrhea, we think of things like traveler's diarrhea. We go to a foreign country, we eat something that we're not used to, or
Yeah.
it's prepared in a way we're not used to, and there's an actual, bacterium or something in there that irritates the gut. And then what the body wants to do, it doesn't want that bad thing in there, so it tries to get rid of it. The easiest way to do that is to speed everything up, draw water into the colon, and send it away. It's really a pretty brilliant strategy on the part of the body, but incredibly annoying for the rest of us. So sometimes when we're not eating properly, we're not getting enough fiber in the diet, or we're eating something that is irritating the gut, like I said, like a FODMAP food, that might that might be a case where the body will speed up and you'll be overly parasympathetic. And and basically we don't want to be in that state, and so we have to dial it back a little bit. That's not to say that the treatment for that is running away from a lion, but we do need to just take a hard look at what's going on. Is it something that's food? Is it a bacterium? Is it something else that's causing that? A lot of people will get that with anxiety. For instance, we talked about public speaking. That's one of the biggest fears of people. People before they run a marathon race or public speak or something like that, may need to run to the toilet because they're nervous. And so the body is just trying to get, speeding everything up to get rid of it. So, and that'll also happen, in a parasympathetic state. If you're frightened, the first thing that, you might poop your shorts,
Yeah, it's true.
but it's an over parasympathetic state. And so the body can flip the switch, and have
Okay.
everything clear to operate efficiently in a sympathetic state. Obviously, that's
Okay.
not a condition that we want to be in, but it's something that we need to take a hard look at when it's becoming chronic.
No, it's interesting. It's a great explanation of that. And especially if something bad happens really quickly, that's why you release everything so you can convert over. I
Right.
mean, that's,
It seems counterintuitive, but yeah, that's really what happens.
yeah, I mean, we see it in animals all the time. They get scared, or, a dog gets scared, there it
Yeah,
goes.
it's
So
piddling.
it makes sense, and we
Yeah.
deal with the repercussions. But
Yeah.
what are some other common gut disorders that you see that may be related to, the vagus nerve, sympathetics, anything like that? That
Mhm.
someone be like, "Oh gosh, wait, that sounds like me. I need to do something about it."
Yeah, one of the ones is called SIBO. It's a small
Mhm.
intestinal bacterial overgrowth. And
Mhm.
it's not necessarily caused by any kind of vagus nerve dysfunction, but what
Mhm.
happens is we have flora in our large intestine. We kind of have a sphincter between the small and large intestines, and that'll get lax. And what happens is that flora that are meant to be in the large intestine end up in the small intestine, which is still, digesting sugars and things like that to give us energy. But now you have a bunch of bugs in there that aren't meant to be there. And it's like a keg party for them. They just invite all their friends, they replicate like crazy. And then
Mhm.
all of a sudden, there's problems where there shouldn't be. Now, these bugs in general, what they've found, it comes kind of in three flavors, and they eat and poop just like we do. And essentially they poop out hydrogens, they poop out methane, and they can poop out hydrogen sulfide. So, generally what I see, hydrogen SIBO is the most common. I have patients who come in and they say, "Doc, I look 6 months pregnant and it's been a long time since I had my kids. So what's going on?" And I always think hydrogen, it's like the Hindenburg, the Hindenburg was a blimp made of hydrogen. Unfortunately, it exploded. That won't happen to you, but we can get those hydrogen bugs out of there. But again, we test for
Mhm.
them. It's a breath test, and take a sugar, we breathe into a specially designed tube for every 20 minutes for a few hours. We get a nice curve going. We can tell if something's overgrown in hydrogen or something's overgrown in methane. Methane tends to go the other way and cause constipation, whereas the hydrogen and hydrogen sulfides will cause more diarrhea, and the hydrogen sulfides cause a lot of bloating and cause a lot of foul smelling stools for more color out there for everybody. But if those are happening, there's always this, this retort like, my poop don't stink. Well, it's actually not really supposed to stink. If you're eating all the right things and putting the right, fuels into it, the right poops will come out the other end. And I know we're getting into somewhat disgusting territory here. It's clinical for me, but when people should pay a little bit more attention to what's in the bowl. At a maximum, if there's blood or mucus in the bowl, that's an alert sign and sign that you got to come in and see a doctor. We don't want that. But things like undigested food, everybody always says corn or black beans. Those are fine. The holes are going to kind of pass through skinned foods like peppers. But if things are too loose or you're not pooping enough, these are signs that you got to make some changes and go talk to a doctor or see a functional nutritionist or somebody that's going to be able to quarterback a program to get you pooping again. Because again, and also maybe test for something like an overgrowth or food sensitivity, because these are really important things, and these are also areas where gastroenterologists are amazing at diagnosing, at scoping, at providing the right medications at the right times. In severe cases, they do surgery, but sometimes there are other things that slip through the cracks, like the overgrowths and the food sensitivities that they're not as expert at dealing with, or that they tend to hand off to another kind of doctor or another kind of coach, to get done. And that's something that naturopathic doctors do really well. And since I've been someone who's experienced that myself, it's I have a real affinity for the gut and helping people get to the bottom of this stuff, because it can go on for a long time and be frustrating. And particularly for the folks who are severe bloating like that, or walking around and their pants aren't fitting and they have no explanation why, and they exercise and do all these things. It's good to have somebody to take a long look at it, really study it, and get to the root cause to try to figure out what to do about it. And that's something that really enjoy doing, and that naturopathic doctors are well equipped to do.
Yeah, and you guys are great at it, because this is what you do, and you get to the root cause of things, which is so critical for not just putting a Band-Aid on what's going on. Actually, let's change and transform a person's life and health. Now, when we think about some things that we often do, like I know this very well, being in the ultra marathon world, over exercising. And one of the things that I worked on personally is I would run 30 miles on a weekend, then get up the next day, run another 20 miles. And as I was running, I knew I was putting myself in a sympathetic state. So I used my breathing and body position to calm myself down into parasympathetics, which was not always great on the trail, because then, you have to go. But well, it felt good afterwards, but in the middle of a race is not always ideal. Let me say that. But so I'm curious, can you talk a little bit about over-exercising and how that has a role in this interaction between the vagus nerve and the gut?
Absolutely. We talked about stress earlier, and over-exercise can be a form of stress. At times, it depends. If somebody's well trained, mentally and physically, that's less so, right? A marathoner who's been doing it a long time is, that's not over exercising that person because they're well trained to do it. But there are plenty of people who do an hour of CrossFit every day, and it's every single day, and they're not giving their body the ability to get in that parasympathetic state and repair everything, and or to get in that parasympathetic state to do the basics like digest or eliminate. And so things can I have a lot of athletes in my practice that have constipation, for example, and and part of that is that we're just spending a lot of time burning up those fluids. But on the flip side of that, those athletes need to eat a lot of calories in order to, fuel their activities. And so
Yeah.
you have more food in and less elimination coming out. And you can imagine that, gone 3-4 days, this starts to get incredibly painful. Waist starts to back up, and, you start to have this counterintuitive you're working at counter to the whole goal, which of exercise, which is to get out and move and, be out in nature and, whatever those goals are to be fit. And then you have this working counter to it where you're building up this toxicity unintentionally in the body. So I always preach to my athletes to take a day of rest. They're always very surprised. It doesn't have to be, laying on the bed and taking a nap for 3 hours. It's just something as simple as, look, take the dog for a long hike as opposed to running another marathon day. And so that's something that tends to help, having some active rest. I tend to see this more in folks who, are approaching or over 40, as they get into their goals, the body starts to slow down a little bit as we age. We have fewer neurotransmitters to move things along. We have lower stomach acid, just like everything else. And so I really enjoy working with those folks as well, and to help them get back to balance.
Absolutely. And I want to touch more on that in a second. I also wanted to touch on what happens when we don't sleep enough, because
Yeah.
that is so common right now. And we're pushing our limits, trying to make ends meet, or, high achievers, we're trying to, conquer the world basically and have about 5 different businesses or more. So can you talk a little bit about just the lack of sleep and what you see when you get under 8 hours of sleep, or whatever that mark is that's, healthy?
Yeah, I'd be delighted to. Sleep obviously is very important. So we've been talking a lot about digest as part of the parasympathetic nervous system, but that rest piece is really important. And we talked about rest between exercise or being in a restful state when you go to eat. But the biggest rest that we get every single day is sleep. And when we're stressed out, we tend not to sleep. The body is vigilant. Going back to the original, lion in the village, that again, that chronic stress can, keep us from getting into a deep sleep that we need for repair. And what happens in that case, if we don't get enough sleep, is that instead of repairing, we end up in a chronically inflamed state, and the body will start to double down on that. So for instance, if you have a lesion, that's not going to heal. Instead of healing whatever, a millimeter a day or whatever the rate is, it's going to kind of stay where it is. And then it'll, get worse and worse and worse as time goes on. The other thing I see that happens a lot with lack of sleep is somebody, may have very fitful sleep over the course of, 7-8 hours. They're up, they're down. And then what happens is when that happens, when that goes on for several days or a week or whatever it is, then they start to get anxious about their lack of sleep. And, and then it becomes this cycle where, they're not sleeping, and then you don't get that repair. And, but so many important things happen when we sleep. What they're now learning is that, so in naturopathic medicine, we also study acupuncture and Chinese medicine, and you can Google this. There are a Chinese medicine clock. Every organ has 2 hours in which it works, and they've actually proven this out now in studies 5,000 years later in the scientific world. But each organ kind of turns on, recycles, and then turns off, moves on to the next one and the next one and the next one. The brain does the same thing. They've found something in the last 5 years called the Glymphatic System, where the brain, is basically doing a little car wash up there, clearing out all the junk. And so you can imagine that if you're not sleeping, if you're not getting into that parasympathetic sleep deeply enough, all those things stop the minute you wake up, because the brain thinks that something's going to happen. And then, you're up, you're amped, and then you got to, spend time ramping that back down. And so you end up and down in these different ways. You're not clearing wastes. And all of a sudden we're down the road to chronic inflammation and disease. And that's not where we want to be.
No, absolutely not. And this is absolutely amazing. And one thing you touched on a minute ago is about when you kind of get around that 40 years of age, you see some shifts in your body. And so what are some of the things that people should look at? So they have a new doctor, someone that's focusing a little bit differently on certain needs? Can you go into that?
Yeah, I started to notice that a lot of my patients around 40, things are different. Most of us have a primary care physician that takes insurance, that, we pay a copay and go in when we're sick. And it's kind of an acute care model. They get us out of illness, everything feels good, symptoms go away. But when it comes to more of a chronic situation, they're less good at quarterbacking that. They'll send out to specialists or continue to prescribe an appropriate drug, which is all well and good. But as we hit like 35, 40, men in particular start andropause. They have testosterone of like 1,000 in their 20s, and all of a sudden it's down to like 300, and they're starting to get some dysfunction. They're not getting the gains they see at the gym. They're getting tired and sleepy, and they're falling asleep watching Netflix on the couch. Things like that. In the women, perimenopause starts. Many women enter actual menopause when it's not surgically induced. Many women will naturally get it between maybe 45 and 55. And, but it's kind of like a light bulb that's not screwed in all the way. It'll flicker here and flicker there. There'll be a period that's missed, or, some sort of symptom like a hot flash. And, most doctors won't take a look at this until you're actually, 12 months without a period and in
Yeah.
full menopause. Whereas, we really treat perimenopause, and we spend a lot of time with people to understand their total health picture. Is this something that's just part of that natural process, or is this something else a little bit deeper? And, can we make some lifestyle changes or make some recommendations, to help get them through and have a soft landing toward menopause, or with the men, get them kind of a little bit powered up, or make some changes to get them feeling a lot better. But 40 seems to be the age where those switches flip. It also flips in the gut and everywhere else, where neurotransmitters and functions start to decline. And that's something that we help manage very well by spending time with people and really getting to the root of it.
That's wonderful. I really appreciate all this information you've given us today. And
Thank you. My pleasure.
it was just absolutely wonderful. How can people reach out to you, and how can they work with you?
Sure. You can find me in a few places. My website is drdanwool.com. Wool is WOOL. My socials are at over 40 doc. We were just talking about over 40. That's a lot of folks that I see and talk about, although I treat everything and everyone. And you can also find me at Chambers Clinic here in Scottsdale, Arizona, and Tempe, Arizona. It's chambersclinic.com. We have a large and comprehensive naturopathic clinic here that's does a lot of good for a lot of people. So those are the three primary ways.
That's wonderful. And you also do a little bit of a Facebook Live thing, right?
I do. Thanks for
What's
reminding
that?
me.
Yeah.
I do a Facebook Live every Tuesday at 12:16, little lunch and learn video.
Okay.
It's over 40 doc on Facebook, Dr. Dan Wool. If you look for me, then every Tuesday at 12:16, I have a video on a different topic, typically gut health and hormones, but I also spend a lot of time talking about self-care too. So.
Wonderful. Well, we really appreciate having you on. Thank you for taking time out of your Saturday to join us and share with our
My
audience.
pleasure, Amy. Thank you for having me.
Wonderful. Thank you all for joining us today for the Weekend Wellness Hour show. Have a great weekend, and we'll see you next weekend. Bye.